The number of malaria cases in Central African Republic has almost doubled in the past year, as statistics show that malaria now accounts for 70% of all child deaths in the country. Children below the age of 5, who are most vulnerable to these mosquito-transmitted parasites, most times do not survive infections. I sat down with the medical director of a pediatric center in Bangui. He says hospitals have no official statistics of malaria cases, but one thing they know is that malaria is the major killer of children.
Vous dire le taux sur le plan national, c'est vraiment très difficile. Parce que vous savez que la République centrafricaine est grande.
The country is very big. There are many people who don't have access to the hospitals because of the conflict. Many more people die of malaria in rural areas.
Dans la brousse, ça veut dire que le taux de mortalité doit être très élevé, étant donné que pour aller dans l'arrière-pays, il n'y a plus d'accès à la prise en charge.
Healthcare providers battle daily to keep up with the influx of sick children. Yet, malaria cases are not reported comprehensively and treatment is inadequate.
My child just returned from school and suddenly fell sick. The doctors have told me that my child has malaria. I just hope she recovers quick.
The situation has been made worse by the instability in the country. Rosin Fiorboy tells us that medical supplies has drastically reduced since violence broke out again in the country, and in most cases, a large number of the population just cannot afford good medical services.
This conflict has made matters worse. Many families struggle to feed, not to talk of taking the sick to the hospital. The situation has even gone beyond malaria. Many children now suffer from malnutrition.
Et du coup, ça fait grossir les dépenses d'une famille et ça crée ce cercle vicieux de malnutrition.
Another rising case is premature birth among women. This again is largely caused by malaria. This preventable disease has pushed the country near a humanitarian emergency. There is hardly any access to good health care in Central African Republic. And in a place like this hospital where it is available, medical facilities are overstretched. Malaria and malnutrition is still the highest cause of illness, especially amongst children. Femi Akonde, TVC News, Bangui.